All right, this is a demonstration on trach care. The patient that we are going to be performing trach care on has a non-disposable inner cannula. So you will have to adjust the actions for trach care. If your patient has a disposable inner cannula, it will actually be easier. In a disposable inner cannula, there will be a box of disposable, singly wrapped disposable inner cannulas at the bedside, but so easier. But we're going to perform the trach care by cleaning the inner cannula on this patient. And so what the first thing I would do is I would evaluate my patient for if it's time. How would I know it's time for trach care? One of two things for sure. It would either be time to clean or replace the inner cannula, or I would observe that my patient needs cleaning. Either one of those two things is a valid indication to perform trach care. I want to identify and gather all the equipment I need. So I want to go to the nurse station, or very often we're keeping a lot of trach care kits right at the bedside. So go ahead and take one of those out. I'm also going to get some disposable trach ties. I'm going to put that within reach here. I'm going to get a bottle of sterile water. And you may want to consider, although it's not mandatory, of course, but you may want to consider using some hemostats. I sometimes use hemostats to just kind of make this look nice and even and pretty at the end of the day. I want to make sure that I've also known before I start this procedure what FiO2 my patient's receiving, if in fact they're on supplemental oxygen, and I want to be mindful of what my humidification system is. So the next thing to do would be to go wash my hands. So I'm going to go off camera just for a few moments, and here I am washing my hands, 15 seconds, dried them, and now I'm going to come back into view. I'm going to introduce myself. Hi, I'm Barbara. I'm from Respiratory Care. It's time to do some trach care. We want to make sure that the inner cannula is good and patent for you, so so that your breathing is easy. And I just want to clean up around your trach. Do you understand? Does everybody understand, or are there any questions? Just kind of answer or ask the people in the room if there's anything that you can answer for them. And if not, go ahead and proceed. I want to put on some disposable gloves. So I'm going to reach over to wherever the regular gloves are in the room and put these on. And now we'll get started.